So spinal surgery, in my practice, is always the last resort. I try to manage my patients as much as possible without an operation. Obviously, there are times when the surgery becomes essential. The most common causes for surgery are intractable pain. We've tried conservative treatment, hasn't helped them. I usually give a trial for about 6 to 8 weeks, and if things haven't settled down, then surgery can be offered. The other options are other reasons why we would offer surgery is if somebody is getting what we call as neurological deficit because of compression of the nerve or the spinal cord. So when the nerve and the spinal cord is compressed, it affects the nerve the way it works. So people can get numbness or weakness or altered feeling down the legs. Or the arms. So if this were to happen, then to prevent further damage, surgery is also an option. Obviously, the surgery has to be done after careful counseling the patient, helping them understand what are the realistic expectations of the surgery, and only after that surgery is offered. The other reasons why surgery would be offered is when it becomes absolutely necessary. For example, Kodak-1 syndrome, which is the compression of the nerves that affect, which basically control the bowel and bladder. If they get affected, then surgery becomes absolutely essential. If somebody is getting paralyzed, losing function, the arms and legs because of compression of the spinal cord for various reasons, then again surgery becomes an essential necessity. Injuries, if patients have fractures, if the spine becomes unstable because of an injury, because of tumor, because of infection, whatever, then again surgery becomes quite important in terms of managing them. So there are various ways of doing surgery. Like they say, there are different ways to skin a cat. So surgery can be done either as open standard surgery, which is the most commonly done procedure, where we make big incisions and a big, depending upon the goal of the procedure. Versus we have minimally invasive surgery, where everything is done through very tiny little incisions. And there's also endoscopic surgery, which is coming up in a big way. And surgery basically is it's quite safe. It's very there's a 90% success rate in most of these procedures. There's always a 10% chance that patients do not improve with the operation, and the chances of having a major complication which can affect the quality of their life is 1% or less. So in a general way, the surgery is quite safe. The precautions that all of us, all the spine surgeons are adequately trained. I've done my fellowships, almost 3 years of spinal fellowships before I could take on a consultant post. So yes, it is safe in the hands of an experienced surgeon. Um, in medicine, there are no absolute guarantees. There is a highly is highly successful surgery, spinal surgery. There's a 90% success rate, and I would say 90% of patients will have improvement in the symptoms after having a spinal surgery. I would say 1 out of 10, which is about 10% of patients, may not improve after the operation, and they may remain as they are. So it's very important that the patient selection is very careful, that is very carefully made, and I make sure that I try everything which is non-operative, counsel the patient a number of times, go through an extensive, detailed consenting procedure before I can offer them any spinal surgery. So unfortunately, there's no guarantees in medicine, and the success rate is about 90% plus. So that's pretty good in my opinion. The chances of having a minor complication like infection, the risk of infection is something between 1 and 3%. The chances of having a nerve damage, which could cause weakness, numbness, or sometimes more pain down the leg, is about I would say 1 in 100. Obviously, these can vary from the kind of procedures that are done. So I'm talking about the more commonly done procedures like decompression, discectomies. As the complexity of the surgery becomes more, for example, when we start doing deformity correction, tumor surgery, then the risks tend to go up as well. The other complications which are common are things like leak of fluid from the spine because of an injury to the sac which contains the nerves. Normally, when that happens, the surgeon or myself, I will repair it straight away. Rarely, it might present a few days after the operation, and patients might need to go in again for a second procedure. The more serious complications like paralysis, loss of life, loss of vision, loss of bowel bladder control, these are extremely rare, and the incidence is less than 1%. But yes, I cannot say that's never happened, and it's there in medical records that these complications have occurred. The patients need to be aware of them. This is again quite a general question because each procedure is quite different. So the more commonly done surgeries like cervical single level fusions, where we put a little piece of metal or an artificial disc from the front. Patients recover really quickly and they go home either on the same day or the following day. Most of my patients go home 24 hours after the surgery. Um, as the complexity of surgery increases, like for example, fusions which are done from the back of the neck, the lower back, which is again done from the back, from the posterior aspect. Patients are expected to stay in hospital for approximately 2 to 3 days. They take about a week or 10 days for things to settle down in terms of the wound healing, the discomfort from the operation itself, for that to settle down. It takes about a week, probably about 10 to 15 days for things to get better. In terms of recovery of the nerve, for example, if patients have had a sciatica, which is a very common problem, most patients will experience improvement in symptoms straight away after the operation. Rarely, if the nerve is compressed for a long time, it's got damage on the inside, then the recovery can be a bit longer. And it's a bit unpredictable if that were the case. Generally speaking, the outcomes in the long run are pretty similar. Whether we do minimally invasive surgery or open surgery, the outcomes are pretty similar. The only advantage about minimally invasive surgery, which is very clear cut, is the fact that the patients can get discharged quicker. They're able to go home. The pain is well controlled, so they can go home. But there are some disadvantages with minimally invasive surgery. It's got a very steep learning curve, so not all surgeons may be able to offer it. It has its limitations as to not all conditions can be managed with minimally invasive surgery. The patient selection has to be extremely careful. Um, and patients have to be counseled that if the minimally invasive surgery were not to work, or if it were not possible during the operation itself, then it might need to be converted to an open surgery at some point, then and there, or probably later. So it depends on the surgeons. It's highly dependent on the surgeon who's offering the procedure. So if a surgeon has extensive experience in MIS, they may be able to achieve quite a bit in terms of comparison between MIS and open surgery. MIS is minimally invasive surgery. So there is no clear-cut answer about this. It all depends on the patient and the surgeon's choice.